So my name is Anja van Hoog. My background is both in medicine. I studied medicine but quite a long time ago and then specialized in tropical medicine and international health. And from there I worked as a medical officer in rural hospitals in Kenya for some years. But then from there on became involved more in public health programs, HIV prevention, HIV care, and became interested in epidemiology. Mainly this interest was sort of triggered because I years ago coordinated a program to promote prevention of mother-to-child transmission of HIV in Western Kenya. It was one of the first programs of that nature because it was a time when antiretroviral treatment just started coming into Africa. And what I felt I was missing was knowledge and skills on how to evaluate such a program. So we were implementing it. It was very interesting to work with the health workers and the hospitals, trained many people, but I thought, at the end of the day, I want to know how effective it has been and what we've achieved. So that prompted me to start a study on epidemiology. And from there on, I moved more into epidemiological research on tuberculosis, also in Kenya. And to date, I work as an epidemiologist researcher nowadays in the Netherlands, supervising people in doing research and being involved in teaching. So we recently finished, for instance, a project that was in Nigeria on decentralized care for hypertension, care in pharmacies. I'm still involved in some wrapping up of manuscripts about tuberculosis in the past. My research mainly focused on tuberculosis control, case finding of tuberculosis. But nowadays I'm more interested sort of in healthcare delivery for all kinds of diseases, because also my background is in medicine and tropical medicine in general. The teaching I'm involved with, or basically from the whole department, is the learning subtrack quantitative methods. So this learning subtrack is part of the research master, of course, because the students learn mixed methods, both qualitative and quantitative. So we here as a group are responsible for all the teaching in quantitative methods, which includes some basic knowledge on epidemiology, which is mainly what I teach. Then there is basics on statistics. It's one of our colleagues here, Daniela. She teaches that part. She's very good at that. She's an econometrist, so she knows a lot about it. Then we have more hands-on practical sessions on learning how to do statistical analysis. Different people from different backgrounds are used to different ways of looking at things and different terminologies. And because the group is so diverse, also in the program, taking people from with different types of bachelor degrees, that already exposes the students to this challenge quite in an early phase, which I think is also quite special. It's also a challenge for us as teachers, because we have to somehow find a common ground and get everyone up to a certain level with quantitative methods, for instance. But I think that is also fairly unique about this program.